A wait period is the time span between the point of getting on a medical wait list up until the meetup with the physician for the appointment or procedure. Wait times are increasing rapidly in hospitals, emergency departments, clinics, and private clinics. CTV News reported this month that clinic wait times have only been on the rise this past year. This upward trend is consistent across Canada. In the surgery department, people are waiting from months to years in life-threatening circumstances. The surgical side of the situation is a lot bigger than just a frustrated patient waiting for a swab, which is why it's my main focus. So, story time. Cassandra is a patient with stage 4 colon cancer. Her surgery was pushed back to December 2021 and then pushed back again until January 2022 and then canceled again, supposedly due to the situation with COVID-19. At this point, the family is not sure if she's going to make it. Hi, Cassandra. So we know you're planning to have surgery and move on with your life, but you can kiss your future plans goodbye because this surgery might get pushed back until your GI shuts down to the point of no return. Just to limit the spread of COVID, though, hope you don't mind. This is what we're saying when we're shutting down critical services. No, this is not okay. This is not okay. The stated reasoning behind the putting off of surgeries is to limit the spread of COVID-19 and reserve hospital capacity and resources. Tell that to someone who might die of colon cancer, right? Not all procedures were halted, but mainly non-emergent conditions. But who decides what is non-emergent? She has stage 4 colon cancer and it kept getting pushed. With this being the case, some client conditions might be cured while others that had less severe conditions were left untreated for longer and are now facing more serious conditions due to that prolonging of their treatment, which causes powerlessness to patients with less acute conditions. But treatment cancellations of any sort cause powerlessness in patients in need. Anywhere, not only in surgery. No client should be forced to wait in pain or in uncomfortable conditions. Of course, they should still have access to pain medications, but these delays are turning simple needs for surgery into serious conditions. This contributes to a much greater risk for acute and chronic illnesses to advance. Not only might diseases progress, but a lot of people are out of work, which causes additional stress. This then creates a compounding effect, where one problem makes 2 more problems. Imagine being in constant pain and unable to work to pay off your surgical bills. Stress, and more stress. So if you're planning on needing emergency surgery and being out of work, you might want to think about checking up on your health insurance situation. Nope, because it doesn't actually work like that. These things come out of nowhere, and when they do, boom, now your mental health is at risk. These conditions put individuals at high risk for demolition and crisis. The Ontario government plans to spend more than $300 million to catch up on the backlog of surgeries left by the pandemic. Although the financial side of things is nosediving, this doesn't mean that we can unpromise fair treatment to clients. Clients who pay taxes deserve access to health care as urgently and with equity, as urgently as possible with equity. Delayed wait times can cause frustration in patients' attitudes towards healthcare services. Comments from patients involved in a qualitative study based on patient experiences with extended wait times demonstrated anxiety, irritation, frustration, and anger. The wait periods cause hostile attitudes in patients, and from my viewpoint, as a studying nurse who will in future be a part of the healthcare workforce, I mean, what nurse wants to have to handle increased in nursing what we call emotional barriers, especially when as nurses we enter every room planning to create a therapeutic nurse-client relationship. This is heavy for nurses. They're the ones getting the smoke for this. Due to this issue, patient frustration is more of a barricade in the relational aspect of nursing, especially those working in really critical areas. Like picture oncology. Imagine the emotional toll it takes knowing that people are in these situations, but as a healthcare team, we are essentially helpless to it. We need to implement a balance between supply and demand for staffing and supplies. Contingency planning is needed. This means that rather than receiving and reacting to patient overload, they are prepared to direct health services more strategically and rapidly, seeing that there is now a major blockage.